Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today we're joined by pharmacist Dr. James Blackburn from the United States. Thank you for joining us today, James.
Thank you for having me, Linda.
So could you tell our audience who you are and what made you decide you wanted to be a pharmacist?
Well, I was a chemistry major in college, so I always had an interest in sort of how the body works. And then I turned into a bit of a ski bum. I moved to Jackson, Wyoming for a few years and was working in various jobs. And during that time, I had applied to law school, to medical school, and to pharmacy school. And I got into all three, and I chose pharmacy because I really liked the life that pharmacists had in my eyes at that time. Some of my friends were pharmacists and they worked, 3 days a week. And when I was, like 22, 25 years old, it sounded just amazing. They were going fishing and hunting anywhere they could do anything. And they were helping people, and it was a big interest. So I went to pharmacy school. I went to VCU, the Medical College of Virginia there, and loved it. The day I graduated, I knew where I was going. I was coming back to Jackson, where I am now, and started working at an independent pharmacy called Stone Drug. And it was such a great place to get to know the whole community, learn so much about pharmacy and OTC medicine and, legend drugs. And then the owner of Stone Drug, unfortunately, had passed away about 6 months after I started working there. And he was the pharmacist, or he was the compounder at that time for those 6 months. And when he passed away, nobody knew how to compound medicine. And I did. And so I started compounding like one prescription a month in this little 2x3 closet that I converted into a lab. And then, after I went from one prescription a month and to one a week, then to one a day. And then once it got to about 3 prescriptions a day to be compounded in my little 2x3 lab, I didn't have time to run the entire pharmacy, pretty much, see over the whole store. There was other employees and compound because I just didn't have the ability to do it all. And so I was turning down like children, like mothers in there, like, can you make some type of suspension for my child? They can't have the commercially produced one. And I was just turning so many people down. It really got me down. And also it's a good time when you're just turning people away who want your business and expertise to open a compounding pharmacy, which I did kind of right in the middle of COVID. And 2 weeks after my son was born, I opened Blackburn Drug in like the middle of May 2021. And since then, I have not had to turn anyone away in the non-sterile compounding world with ingredients that I can get, which is a good feeling, being able to help everyone who asks for my help. And yeah, our business is well respected. We have an incredible front end with what I find are like the most optimal supplements and nutrients, vitamins to take, being able to pick out exactly what I want in terms of, methylated vitamins and absorbable perfect proteins, the calorie to protein ratio and protein bars. Everything that we have up front is really curated for what I think is the absolute best that you can do for yourself. And I find that it's a story I tell a lot, like people always, or a lot of people want to do the best for themselves, but then they don't have the tools to do it the best for themselves. So their doctor tells them, you need to go get on a B complex. And like a lot of people I know, they went to Costco and got 1,000 B complex for, $14. And then they take them for the year until they see their doctor again. And, none of their inflammatory markers have come down. It's like, well, I thought you were going to be on a B vitamin. It's like, well, I am. B vitamins don't work. But in that functional medicine world that we live in now in this store, in my pharmacy, the B vitamins that we have, they do work and people's inflammatory markers do go down. So it's just nice providing people with, you know, supplements that actually work. And I know that they work versus you go to Walgreens and, 60% of people have either one of the MTHFR or CompT genes. So it's like 60% of people can't absorb or metabolize these vitamins to even make them work for themselves. So why would they sell those? You come into my store, every vitamin in here will work for every person. So it's just a nice feeling giving people the best that they can have. And in the compounding world in the back in the lab, it's, we're being the absolute best that we can with technology. We have instrumentation back there now. But the machinery that we're running is, accredited and it's making perfect compounds that we send out for testing and verification. So I feel really good about the direction that we're in.
Before we talk about that, what happened to the 3-day a week that this young student thought he was getting into with fishing and skiing?
I'll tell you what happened. I got married. Yeah, and she didn't. It was great. I would stack 6 days of work in a row, and then I'd have 8 days off. And so I'd go being in the woods or go fishing and hiking, being outside. And that's one of the main reasons I moved here into Jackson. It's just such an outdoor community and endless lands of fun. Yeah, she put a stop to that after we needed to make a little bit more income, buy a property. And so, yeah, now
So
I'm working 5 days a week, 2 kids.
Oh, okay.
I'm a Monday through Friday. And I take my kids to school and she picks them up and it's going well. But yeah,
Oh, that's good.
Adulting is what happened. It was a fun time while it was. I'd recommend everybody do that.
Yeah, it's welcome to the real world, isn't it?
Absolutely.
So we know that all compounded drugs aren't equal. We know that some compounding pharmacies take extra care and have third-party testing that you were talking about. We also know, unfortunately, some people are still being told to buy the 50 milligram tablets of LDN and mix them themselves, which is not best practice and it's not accurate either.
Yep.
If somebody came to you and asked how much your LDN 4.5 milligram tablets or capsules or whatever of LDN, and they've shopped around and found somebody else that does it at half the price, what do you say to them why yours is more expensive?
That's a good question. Mainly because you talk to some other compounding pharmacies and they take their, to make a 4.5 milligram LDN cap, because of the salt conversion, you have to weigh out 493 milligrams of naltrexone. And then you would mix that typically with, say, 24.5, 25 grams of microcrystalline cellulose. And some pharmacies are still putting these in Ziploc bags and shaking it up. And that dispersion factor is like, do they know that they're shaking it up properly in a mortar and pestle, or is all the lightweight naltrexone just coming up into the hood, getting sucked up? When we have an Invomatic back there, which is from Fogron, but they have exact testing on how to do so many different powders that have similarities that, you have quantitative data that they've produced that you can follow. And then I do this with all my thyroids, but we send out, same exact process, but with even less ingredient. When I'm doing 1 to 1,000 dilutions with thyroid, we're doing it in the same machine, and then you get them back that they're 99.9% accurate. and you can still make those micro adjustments to make it 100% accurate. But yeah, the something that I hear is like, we don't make Buicks here, we make Cadillacs. The stuff that I have is absolutely perfect. I have full confidence in that, and that's in machinery that we're investing is running planetary mixers and spinning powders and diluting them, and it's worth that extra cost to know that what you're taking is what it says on the bottle.
Mm-hmm. Well, that's the thing, isn't it? So you have the extra expense of the equipment, you have the extra expense for the third-party testing, and it comes at a cost. But at the end of the day, you can say, hand on heart, that 4.5 capsule or tablet, whatever it may be, is definitely got 4.5 milligrams of naltrexone.
Yeah, exactly.
And
it's a good feeling.
Yeah. Yes, exactly. So let's talk about formulations. What formulations do you make your LDN in?
Oh, a few actually. I've been making some old capsules 99% of the time, I would say. And then those range. Well, now we're doing micro dosing and the low dosing. And I'm doing some kind of full size dosing with naltrexone in certain situations. But we do them in, any single strength that you want, because I typically, from what I see, titrations work the best to get people up to a 4.5 milligram level if that's where they want to be, which the clinical, says 4.5 milligrams typically. But capsules, we make them in oral dissolving tablets, rapid dissolving tablets.
Really? I've not heard of that before.
And now I guess it's been a few months. Mediska came out with Novafilm, which they did testing with low-dose naltrexone on, and it's a little bit more expensive than typical. But for people who naltrexone fails on, it's because like their body isn't absorbing it, or it's getting degraded, or some other reasons. But these Novafilms, like the transmucosal delivery of it is far superior, and the levels that you can see in the body that they tested with this clinical trial were there. And so the guy who like kind of convinced me to buy this machinery, he was like, anybody who it fails on, try this and it'll work for it. I guarantee. And we use it now for a lot more in the erectile dysfunction world because of the rapid onset that it can provide with transmucosal absorption.
So is that just a piece of film that you put inside your cheek?
Mm-hmm.
Yeah.
Yep.
Okay.
And then liquids, right? Suspensions, we do those for people who don't like capsules. And then I've been making topical low-dose naltrexone for a few patients with eczema. Mm-hmm. And I'm really hoping that they follow the directions for a good 4 months and see how it goes for it.
Some prescribers prescribe the oral at the same time as the topical. So they're, hitting it both ways. And then
that's with these two patients.
Mm-hmm. So your lab is a non-sterile lab, I take it. So you couldn't do nose spray or eye drops.
No, we can do nasal sprays, but not eye drops.
Okay.
Eye drops are a sterile compounding pharmacy.
Yeah.
And I've never done a nasal spray though with naltrexone. That'd be an interesting one. Again, rapid onset.
For people with Sjogren's syndrome, it seems to work quite well. But with the eye drops, the shelf life is very, very limited. So then it makes them very, very expensive.
Yeah,
I think it's only like a couple of weeks or something.
I think with
very long.
The new USP, it's like 14 days with that, yeah.
So that's really expensive. So when you were saying about doing the microdosing, how low do you go?
It was, it was in the microgram single digits. I think it was 10 micrograms.
10 micrograms, okay. Yes. So are you working with pain specialists there?
Yeah, it's also, well, I guess low-dose naltrexone has been heard of, and now it's like you can very popular. But yeah, pain clinics. We have a lot of functional medicine physicians in town, some integrative doctors that are been using naltrexone for the 15 years with me. Um, Dermatologists, but yeah, pain clinics, the even some, yeah, the orthopedics, some of the injectors who are constantly seeing people for cortisone injections, and the it's funny. I've talked to these like the pain physicians, and they say that low-dose naltrexone works for every single woman over 70 that has osteoarthritis.
Really?
And I'm like, and then it's like, well, what about the men, right? You know, back and forth. But they say, like, I don't know. They haven't given me that answer. But they say for every woman, they see
Okay.
results. They prescribe it often.
Hmm. Okay. Do any of your doctors, prescribers, because they could be nurse practitioners, wean people off of opioids and transfer them to LDN? Do you know?
I have not seen that. The micro doses that we made were for a patient who was also on opiates. And that microdose regimen, I only made it once, but I don't think we followed through with it. But
Okay.
no, it's, I don't know, our community here with the local community, everyone, everyone that I sort of know and seen and been here for a while, like opiates aren't I'm sure they're a problem. You know, there's got to be problems everywhere with them because they're addictive.
Mhm.
But in our community, people want to get off medicine and be healthy and get back to being outside doing whatever it is they do out there. It's really cool to
Skiing,
talk to like folks.
hunting, fishing.
And then there's biking, kayaking, I mean,
Yes.
there's so many hobbies. Your garage can never be big enough. There's too many toys. But like the surgeons are friends. One of them is from Alabama, and he was telling me, you know, he just did a knee replacement on like an 85-year-old man, and the first thing he asked was like, when can I go skiing again? And he's like, in Alabama, when I was doing these, it'd be a 60-year-old man potentially, and they would never like they don't want to heal, or it's just different communities. Our community is very active, strong, and yeah, Peter Panish. They're all young and wanting to ski forever, you know.
What about mental health issues? Do
We're
you know?
using them a lot more, I feel like, because like naltrexone, low-dose naltrexone undoubtedly decreases systemic inflammation. And as there's direct correlations in the cognitive world with inflammation, anxiety, depression, and it's just a domino effect. And some of the, you know, cognitive therapists, they'll start people on low-dose naltrexone to decrease that inflammation, to reduce anxiety, depression, alcoholism, whatever non-sleep that potentiates from those symptoms.
Mhm.
So yeah, we do that quite often, I
And
feel.
then the other thing, infertility and women's health. Do you do a lot in that area?
No, I'd love to know more about that.
Ah, well, we'll have to teach you. Um, Dr. Phil Boyle has been using it in his um, fertility clinic for about 25 years, something like that. And it's quite amazing. If you go onto our website, www.ldnresearchtrust.org, and
Mhm.
look at past conference recordings, and he talks about it. And he did a study, and he found that the women who were miscarrying or couldn't get pregnant had a good pregnancy. They took the LDN to get pregnant. They took it throughout pregnancy. He gets them to stop a couple of weeks or so before birth in case they need pain relief. And then they go back on it and breastfeed. But he said the babies were a good weight. Fewer of them had to have antibiotics when they were born. They were very, very content. They slept well. They reached all their markers. they were just healthy bundles of joy. It was quite amazing, the results he found from this test. Yes, my mother would have been delighted if I'd have taken LDN as a baby. I was born 5 weeks early, and she said for that 5 weeks I cried. You know, in between sleeping and drinking and pooping, I cried. She couldn't do anything with me. She used to feed me, change me, wrap me up. I was born in July. Take me down the bottom of the garden, put the cat net on the pram, and go inside and close all the windows because she just couldn't stand my crying. And the day I was meant to be born, I stopped crying and I was a happy baby. But that 5 weeks, I complained. I obviously didn't want to be born that early. Yes. So yeah, she would have been delighted if she'd have had a happy baby.
I love hearing that, though. Not the screaming part. I'm sorry about your poor mother for those 5 weeks, but that's this low-dose naltrexone fertility. I can't wait to listen to that, learn more.
Yes, yes, very interesting. He's had such great success rates because there are some women that have repeated miscarriages. I know one lady, she was trying for the last time when I was in hospital, and she'd had 8 miscarriages in a row. You know, she just, sometimes she lost them at 3 months, sometimes it was like 8 months, you know, anywhere in between. I mean, it was really, really sad. She was desperate to have a baby.
I see a lot of that out here. And I think that's everywhere. But so many, I'm in that child birthing, the age group. My friends are all having babies and have had babies, and now, but so many people struggle with it, and it's so hard. You feel like it's supposed to be an easy thing, and for a lot of people, it's really hard to have something they could offer. Yeah, that's really.
But it affects you mentally as well, doesn't it? You know,
both men and women. The woman absolutely, but like the husband, it's everyone. It's a full, yeah. Family making it's hard, but it pays off. Yeah.
Yeah. My first pregnancy was a stillborn, and that was really difficult. I found that very hard. And then I had my eldest daughter, and they took me in hospital for observation. Soon as you miss your period, let us know. I was 5 weeks pregnant when I had the first scan, and they said, we'll keep you in 2 weeks, then another 2 weeks, and we'll keep you in until you're 3 months. We want to keep you in till you're 20 months. And I never came home. I spent the whole pregnancy in hospital, and I was fine. Nothing happened. Everything was fine. It went smoothly. I got bigger and bigger and bigger, lack of exercise because I wasn't allowed to do anything. It was bed rest. And then I was desperate to have a second child. I was an only child and I didn't like it, and I wanted to have 2. And I had the pregnancy confirmed on the Tuesday, and it was twins, and I miscarried on the Thursday. But even though that's awful, it's not like losing a stillborn, because it wasn't, you couldn't feel it moving, and you weren't any bigger or anything. But then I went on and I had a second daughter. So yes. So when I got pregnant, they said, we'd like you to come in for observation. I was like, no, I've got a 4-year-old at home. No. And I had to agree that I'd have the midwife in every week. I'd have a scan every fortnight. And I didn't know if that would harm the baby, but having so many scans. And I agreed that if the results showed there was an issue, I would go in hospital. But until then, I wasn't going to. And I managed to stay at home the whole time. So I was pleased. I mean, you can't just say to a 4-year-old, okay, I'll see you in 8 months.
Yeah. Or we're moving into a hospital for 8 months. You got to come.
Exactly. Yeah. So,
man, the story. Yeah. See, it's nothing. It's hard.
It is hard. It is very hard mentally. And the first time, having done antenatal classes for all these women, and I lived in a town and everybody knew everybody, I would see one of the mums with a baby in a pram, and I would dodge into a shop, any shop, just to escape, because if they hadn't seen me for a while and didn't know, it'd be, oh, and where's your baby? And it was horrible having to say to everybody, well, I lost my baby. Yeah, not nice.
That's hard. That's terrible. I'm sorry.
Well, I haven't actually ever told anyone before, but for 11 years I blamed myself, because they did an autopsy and there was nothing wrong. The baby was healthy. So that's why they said, you'd be okay to get pregnant again. So if medically there was nothing wrong, I'd killed the baby. I'd done something wrong. So for 11 years, I blamed myself that I'd killed this baby. And one day it used to come over me like a wave. I wouldn't be thinking about it, and all of a sudden I'd think about it, and it was just like a stab to the heart. It used to take my breath away. It really hurt. And then after 11 years, one day I was getting in the car, this thought came to me, and I was waiting for the impact of it to hit me. And I suddenly realized I'd forgiven myself. I couldn't see what it was I'd done wrong, but whatever it wasn't my fault. But it took 11 years to get there. But in those days, you didn't have counselling or anything. So I had nobody to talk to or unburden myself, which probably would have helped. But 11 years is a long time to blame yourself.
That is. And that's incredible that you accomplished that and forgave yourself, or understood.
Yes, took long enough.
Yeah, that's a story.
If people wanted to get hold of you, how do they contact you?
I guess the best would be probably via email, through my website. There's places that you can reach out, but info@blackburndrug.com is a place that we're always looking at, and questions get sent all the time there, and I answer them all the time there.
So do you only ship to Wyoming?
No, I'm licensed in Wyoming, Idaho, Colorado, and Florida at the moment.
Well, thank you very much for having joined us today. And
thank you.
Are you going back working or hunting, kayaking, skiing?
I'm going back. I got to go to work. I got to get back in the lab and start making more stuff.
Okay. It was lovely talking to you. Thank you very much.
Nice talking to you. Thank you. Have a good afternoon.
Bye-bye.
Cheers.
Any questions or comments you may have, please email me, Linda, Linda, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.